Good morning, doctors. Welcome again. Our today's topic is natural barrier methods, natural contraceptions. How we prevent pregnancy in a natural way, like abstinence during fertile period. Ovulation normally occurs on 14th day of cycle, so we can say 12th to 16th day ovulation may occur. Why? Because it's not possible, it's exact 14 days. So we have to person, those who don't want lady, those who don't want to pregnant, couple, intercourse 10 to 18 days may result in pregnancy within 10 to 18 days. Okay, which method is based on Ogneoknos method. This is known as rhythm method or calendar method. Ogneoknos is rhythm method and calendar method. Okay. Now billing method, what is it? This billing method is by cervical mucus. Calendar method or rhythm method, what is it? Avoid intercourse between 10 and 18th day. So if a cycle is a 35 days, I will explain you how, which is safe or unsafe period. How to remember this way. See, this is 0 day, this is 21st day, and this is 35th day. So 35 minus 14 is 21. If we do 35 minus 14, is it 21? So 21st day is approximate day of ovulation. So 21 minus 4 minus 5, 21 minus 5 behind is 16, and 21 plus 3 in front is 24. So 16 and 24 day is a unsafe, and this is the high risk of pregnancy. So absenteeism, or we can say calendar or rhythm method, this is known as. For this method, the failure rate of pregnancy is very high, 25 pregnant women per 1000 women years. Okay, per 100 women. Now second is mucus method or billing method. We can say mucus method or billing method. Estrogen influences this method. Intercourse only periods. Okay, dry periods. Intercourse only dry periods. How to remember? This is our finger when the cervical mucus is the very thin, not thick. It's early mucus. When it transitional mucus, that is also safe, but when this mucus in such a way very thick, like this finger, I will explain this mucus is thick, so this is highly infertile fertile period. So stop intercourse this highly fertile period. Now another method is temperature method. When the body temperature rises, why? Due to progesterone, and this is also high fertile period. Now withdrawal method, or we can say coitus interruptus, husband ejaculate outside. This failure rate is also so high, 25 per 100 women years. High rate of failure. Why there is a high rate of failure of withdrawal method? If he ejaculates sperm outside, but still there is a prostatic fluid and it contains spermatozoa, so high chance of pregnancy occurs, 25 per 100. Now breastfeeding, if a lady or mother breastfeed his child every 4 years till 6 months, that increase the prolactin, and prolactin inhibit the FSH LH hormones, and failure rate is 0.5 to 1.5%, quite less failure rate, guys. But if a lady who is in lactating age not feeding her baby, the rate of pregnancy is higher. But if she is feeding her baby every 4 hourly, then prolactin releases more and more, and that's why less failure rate. So this is the very much beneficial and good natural way of preventing pregnancy. So guys, have a good day. Goodbye. That's all for today about the natural methods of contraceptions. And in our next video we are going to discuss about the barrier methods. In our first video we already discussed about the ovulation mechanism. So guys, have a good day. Goodbye. That's all for today, and if you have any queries, any question, you can ask me. And if you still not subscribe my channel, please subscribe it. And thank you. Goodbye.